Hello, everyone. Welcome back to the second episode of Journey to the White Coat, a podcast dedicated towards helping pre-meds on their journey to medical school. I'm your host, Connor Asmus, and today I will be interviewing Dr. Tree Nguyen.
Thank you so much for joining us, Dr. Nguyen. It's great to have you on the podcast. Could you introduce yourself a little bit?
Yes, thank you so much, Connor, for having me. My name is Tree Nguyen, and I have had the privilege of being a physician for 27 years now. My foundation is board certified in dermatology, and then I pursued a subspecialty in dermatology called Mohs micrographic surgery or dermatologic surgery. And that is 1 year fellowship after your 3 years of dermatology. And so I've been practicing for 27 years. And let's see, I've been a Texan since 2003. And so not a native, but certainly love Texas and would never leave.
Sounds great. I wanted to start by asking you a little bit about your early journey to medicine, like what inspired you to become a physician. A general question, what kind of inspired you to pursue medicine?
Well, you could say that it's in my genes, Connor, because I'm a fourth generation physician. But you would think that it was pressure from my parents or other relatives, but it truly wasn't. The fact that I'm fourth generation just means that I continue the passion that my father and my grandfather inspired in me. My grandfather actually was the one who was the most pivotal in influencing me to think about medicine. You know, he was a head and neck surgeon in Vietnam, and it was at a time when there was the war in Vietnam and the French occupation, and he always described medicine as something almost mystical in the sense that you have an incredible sense of you have incredible privilege, you know, to take care of people. And some of the stories he would describe were just so amazing to me that that was from an early age, that's what I wanted to do. So I think at the age of 5, my mom recorded my voice because at 5 years old, I had to leave my family and escape the communists. So she recorded my voice and said, you know, Tree, what do you want to be when you grow up? And so at the age of 5, I said, I want to be a doctor.
Yeah, I think it can definitely be helpful to have the family to provide support and guidance into the journey. I know a
Right.
lot of other AED members talk about their parents or family members and just getting resources and just being able to ask them questions about it. Another thing is, I know that you did the BAMD program. I actually have a relative, a somewhat distant relative, that is doing that right now. So I was just
Oh,
kind of
great.
wondering, what was your experience with that?
Yeah. But back to the family comment you mentioned earlier. I think sometimes having family in medicine is can be counterproductive. For example, um, I would say more than half of my colleagues who are physicians are not encouraging their children to go into medicine. And so depending on, you know, your parents' experience or your relatives, it can sometimes be discouraging, you know, to go into medicine. But in terms of the BA MD program, I went to a 6 year program in Kansas City, Missouri. I was in California at the time. And in this program, you apply from high school. And once you're accepted, you matriculate into a combined college and medical school curriculum. And believe it or not, this is actually the way that it's done in Europe. So in Europe, from high school, you take a baccalaureate exam, and based on your score, you can enter into medical training. And so there's no such thing as a separate college and medical school like it is here in the US. I thought it was wonderful. I thought that it was exactly what I needed because the class size was small. Our class size was only 100. And we entered from high school into this program. We gained experience with clinical care and patient care from day one. I remember the first week of that program, we were introduced to patients and how to talk to patients, and we had mentors who guided us through the entire journey. The program was accelerated in the sense that you couldn't major in anything that you wanted. You had to do a certain, you know, Bachelor of Arts degree because there wasn't enough time to explore. But for me, that was perfectly fine. I knew I wanted medicine and I didn't want to take any classes that weren't relevant to, my future goal. So I thought it was wonderful. We grew up together, my classmates, and I thought I had a wonderful clinical experience. And I would definitely recommend it to anyone who truly knows that medicine is for them. And that's the hard part. That's the question that a lot of people don't know.
Yeah, I think it's interesting you mentioned Europe being like that because I actually this past May we went on the brigade to Vietnam actually,
Hmm.
and it was interesting to see because the physicians there they do I believe it's 5 or 6 years and they have like stars for the different number of years of their training.
Right.
And it's just like so much different from US where we do 4 years and then like maybe a gap year or two or more. And you're like 24, 25 versus there, you're just 18, you want to become a doctor, you apply for that. It's a lot different.
Yeah, there's definitely pros and cons. I
Yeah,
think the
definitely.
disadvantages is you don't have, for people who are not sure, you can sometimes enter in for the wrong reasons. For example, in the 6-year program I went to, there was a 25% attrition rate in the first 2 years. So 25% of the class dropped out or withdrew because they found out that, hey, maybe this is not for me.
I also wanted to ask you if you had any mentors during your undergrad slash medical school that kind of inspired you to do not only dermatology, but just like kind of inspired you in general.
Yes, I do. I've had probably two physicians come to mind. And my medical school did not have a dermatology department. And so these mentors that I'll mention are more for just being a physician. So one was Dr. Marjorie Searage, and she was a hematologist oncologist. And the other was Dr. Gary Salzman, and he was a pulmonologist. So Dr. Searage, she was amazing. Being a woman of her time, she was truly at the frontier, breaking glass ceilings. And what I loved about Dr. Searage was that she pulled me aside one day during her rotation, and she said, Tree, you could be doing better. And that was like a shock to me, because you often, well, you don't get that feedback often. So, but she took her role as a teacher seriously, and she saw that I had potential, but I wasn't maximizing my potential. So she pulled me aside and said, you can do better. I think that these are the things that you need to work on. And I took it to heart and I applied myself. I corrected some of the flaws that she observed. And I really appreciated that. And to this day, I'm very upfront with my students. If I see something that they can encourage upon, I follow Dr. Steerage's example and help them with that. The other thing Dr. Steerage was amazing with was that she emphasized the role of literature and poetry in medicine. So she had us read many novels and poems related and unrelated to medicine, but all of them reveal more of the human spirit, the sense of compassion, human nature. And I think all of that was extremely helpful in my journey as a physician. Dr. Salzman was also amazing because you'll probably get to this in medical school, but pulmonary and critical care is very difficult. All of these numbers and ventilation settings can be quite confusing, and he made it so simple. And he had an art of taking you, to the bedside, showing you from the complicated to the simple. So that was his gift, making something so complicated into something that is concise and simple to understand. So those, I would say, were my two mentors for as a physician in general.
Yeah, I think like you mentioned, being complacent can be a big stepping stone for a lot of like pre-meds. Me personally, I have my mom that kind of tells me like you need to do better, but in like a nice way, of course.
Right. Well,
Because she
good.
was a PhD in operations research, and she's like, you need to be better than I was. So I kind of use that
Mm.
as like, I can't just sit on my butt like watching TV. I need to be assertive and not be complacent, I guess.
Well, great. I'm glad you have that someone in your life.
Yeah. I also wanted to kind of transition towards asking about your residency. So I was kind of wondering how was the dermatology residency structured? Like, what were some rotations that you particularly enjoyed, and just your overall experience with it?
Yeah, so dermatology, to become a dermatologist after medical school, you do 1 year of internship, and that's a year of general medicine, internal medicine. And then you do 3 years of dermatology specialty. So my 1 year of fellowship was at UCLA, and then I went to Boston for the dermatology part. And I would say I was more tired, more exhausted as a dermatology resident than as an intern, which is really hard to believe because as an intern, you're on call sometimes every third night, you pull late hours, and it was very strenuous. But in dermatology, the tiredness came from the fact that you are learning at a completely new language. You know, dermatology is truly something so different from the rest of medicine that most students don't have exposure to that as a medical student. So when you go into the specialty, it's so new. And also the pace of the clinic is very quick. You can see anywhere from 50 to 100 patients a day and divided among the residents, of course. But you have to be very efficient and you have to learn the specialty as well as communication all at once. And so dermatology was strenuous the first year. But in terms of the residency itself, I thought it was amazing. I was lucky enough to train at Harvard and talk about imposter syndrome. You know, when my medical school was great for clinical medicine, but it was very weak for basic science research, whereas Harvard was completely very research oriented. And so my fellow co-residents, they probably half of them had PhDs and had done extensive research and had published. And compared to them, I truly felt like an imposter. So in that sense, it was a little bit difficult. But the great part about residency is that your residents become your friends. You're mutually supportive, and you bond together, so that it makes the journey very rewarding.
Yeah, it's a little bit similar, but obviously different for like undergrads and pre-meds. Like, we go through the same struggles,
Hmm.
and we like take the same hard classes, but it's obviously on another level in residency and such a hard to get into specialty like dermatology. You also mentioned some of your like on-call nights, working so many hours. So how did you kind of get through that, and what kind of motivation did you use to like push through, I guess?
Yeah, well, the good news for in terms of the hours, the good news in terms of residency training now is that it's not as intense as when I train because there are limits now to the work hours residents can have through the week. Whereas when I was training, there were really no limits. So, but regardless, it's a stressful experience, as you mentioned. And I think at least what helped me, is that you always I'm always a big picture guy. You know, I always think, what is the end point? You know, what is the goal? And when you focus on the goal, you don't mind so much the small things that can make a day, stressful. So that's one advice I would give, is have a big picture in mind. The second is that it's when you're doing a residency, you tend to focus on, what's difficult, the hours, the sleep deprivation. But I've never been one to focus on the negative. I've always focused on the fact that everything that everyone else thinks is stressful, I think of it as an opportunity. I think of it as an opportunity to learn, an opportunity to take care of people. And when you have the optimism plus the big picture in mind, you get through it fairly easily compared to someone who's negative and, pessimistic.
Yeah, like you mentioned, big picture. For me personally, I think it's easy to get caught up in like being the best or better than other people, or like I want to make the most money. But I feel like at that point, you're not really going to reach the goals that you want to achieve. Because at the end
Hmm.
of the day, we're all in it to help other people. And I feel like as long as you keep that in mind, for me at least, has been helpful to be able to push through.
Yeah,
Um,
absolutely.
I was also wondering kind of what your expectations were going in, not only to your intern year, but the rest of it, and like what you found was different from what you thought it would be.
Hmm. So, in terms of expectations, um, one of the one of the factors that always drove me was that I felt like I was uh, going to any training, any experience, any rotation, any specialty, regardless of what I did, I always felt like I had to represent more than myself, in the sense that, yes, I'm there as an individual and I had to perform for myself and do well. But as an immigrant, as a someone who is a refugee, someone who English is a second language, I often found myself as one of the few Asians in the program, or the only Vietnamese to have ever entered the program. And I always felt like I had to represent a lot more than just me as a person. And so my expectations for myself were quite high, because of that factor. But what I found out is that, the great thing about American education is that, it truly is a meritocracy once you're in. And you don't need to prove yourself to anyone, but yourself. So I found that the pressure that you place on yourself is always so much greater than what other people expect, of you. And that I learned to forgive myself, many times. And I think that's probably a good thing to remember is, be kind to yourself, forgive yourself for the missteps that you may have taken, as long as you learn from it. But don't ponder over it. Don't punish yourself for not being perfect because perfection's a great goal. You'll never reach it, but just be happy with yourself.
Yeah, that's a lot of powerful insight. So thank you so much for that. Now I want to kind of transition towards your current day in the life and more of an
Mhm.
open-ended, like what does a typical workday look like for you, and how do you kind of balance surgical time versus like patient care and talking to patients?
Sure. I work 4 days a week. I used to work 5 days a week, but for the past year, it's been 4 days. And 2 of those days are strictly surgical, and 2 days are medical patients. So, a typical day is I always work out in the morning. I come to the office early. I have a gym in the office. I work out, take a shower, and then get ready for patients. For a medical clinic day, I'll see anywhere from 40 to 50 patients. Average is about, 45. And it's very rapid pace. We see patients anywhere every 10 to 15 minutes, but yet I still feel like I give as much time as the patient needs. I'm usually on time, and I'll do my notes, my charts throughout the day so that the end of the day, I have very few notes to bring home. I'm also fortunate because I've hired enough staff so that they scribe for me in the room. And so I have 100% face time with my patients. I'm never, looking away, typing something and being distracted. So my clinic days are a rapid pace, but very, very rewarding. My surgical days are very different. So instead of 50, 45, 50 patients, I'll see maybe 10 to 14. But the surgeries can be long. The surgeries are cancer removal, pathology examination, and then reconstruction or restoring the patient back to their normal looks and function. And that part I really enjoy because unlike the clinic where you only have 10 to 15 minutes with a patient, in surgery, you have anywhere from 30 minutes to 2 hours with a patient because each surgery can last that long. And all of the surgeries are under local, which means the patients are awake, they're talking to you, they're comfortable, they're pain-free, but they're conversing with you. And so I find that time extremely rewarding. I'm learning from them. They're teaching me about their life experiences. I'm sharing with them what I know. And it's a great exchange of the human spirit. And I think that no other profession has that much time with their patients as I do in Mohs surgery or in a surgical day. So that's a typical work week, Monday through Thursday.
It is kind of incredible how like much we take for granted, like in American medicine, how you can like be operating on someone's skin while they're talking to you. Like if you think of it 200 years ago, they would think that was like absolutely crazy just for that to be a possibility. Um,
Yeah, yeah,
so
it's a
it is,
gift.
yeah, it definitely is. I know during our GBM you talked some about how amazing Mayo Clinic was, so I was wondering if you could talk a little bit more about that.
Sure. So I think Mayo Clinic, Rochester, which is where I did my fellowship, and I was on faculty there. Mayo Clinic was the first multi-specialty clinic, in probably the world, but it's definitely in America. And the Mayo brothers and their father had the vision of assembling different physicians of different specialties together to practice for the benefit of the patients. And so one of the missions that Mayo has three shields. If you look at their logo, it's education, research, and patient care, and they really intertwine those three shields seamlessly. Uh, at Mayo Clinic, one of the quote from the Mayo brothers is that the needs of the patients is the only thing to be considered. Basically, what's best for the patient is the right thing to do. And so at Mayo, all of the physicians are salaried. So your salary would depend on your specialty, but you get a straight number as your salary every year. If you see more, you don't get more. If you see less, you don't get less. Or you get that salary based on your specialty. And I think that's very powerful because then you're motivated to do what's best for your patient. You're not motivated to do more surgeries because you're going to get more money. Obviously, if you're lazy, that can be a problem. But the Mayo Clinic has a great track record of attracting and recruiting people who are hardworking, highly motivated, and have patient care on their mind. So that's the amazing part about Mayo is that you have a singular mission. You have everyone from the greeter at the front door to the nurse to the physician to the cook. Everyone has that mission in mind. What's best for the patient is the right thing to do. So I find that unity of spirit and mission very unique. Many hospitals will say the needs of the patients come first, but the practice of that goal is very divergent. And I find that very few hospitals truly have that mission practiced throughout the institution. Mayo Clinic is the exception.
Yeah, I think that makes a lot of sense just given that American medicine has become very for profit and that you need more surgeries, more patients, and it like kind of eliminates the patient doctor interaction and just getting to know one another. I feel like that can help their trust a lot too, and that they trust you to give them more time and to actually get to know them versus viewing them as a paycheck.
Right.
Um, and I was also wondering how kind of the transition was. I know you worked at MD Anderson after that, and then you went into private practice. So I was wondering how the transition was from a more hospital base into your own practice, and like, was the business side a lot different? Was the medical side a lot different?
Mm. So yes, the transition, I did 12 years in academic medicine, at Mayo and at MD Anderson. And the transition from academia to private practice, you would think is more difficult, is more stressful, and is more time consuming in terms of the business management. And to some extent, that is true. However, I did not find the transition very difficult, probably because of my mindset. Again, I'm all about taking opportunities rather than thinking of it as an obstacle. So I found that the ability to manage my practice uh, and develop the experience that my patients would enjoy. And what I mean by that is the design of the building, the design of the waiting area, the design of the room. I had complete control over that. I didn't have to go through a committee. I could, um, purchase anything I wanted to create the vision that I wanted. So I found that ability to control and manage very liberating. I thought it was freedom, completely, rather than stressful. Also, the management of the staff, the personnel, hiring and recruiting, I found that to be very liberating because no longer does a nurse manager have to have, hire the person for me, which is that with the way it was at MD Anderson. I could hire them, I could interview them, and I could recruit what I think was the best person for the practice. And so the other thing about managing your staff is that it's very rewarding to see them come in knowing nothing and then developing their knowledge and seeing their skills grow and then seeing them excited about what they do and seeing how their knowledge improves. That it's almost like raising a child. You see them grow up and become successful adults. So I found all of that incredibly rewarding and something that I enjoy very much. So I didn't find the transition that difficult.
Yeah, that makes sense. Kind of wrapping it all together, I was wondering if you just had any general advice for like pre-meds and med students like earlier on in their journey? Like maybe what were some mistakes or misconceptions that you kind of learned from and what was overall helpful in your journey?
Yeah. Well, uh, I can tell you that based on my own experience, as well as having students in my practice pretty much 9 or 10 months out of the year. So we have a lot of rotators ranging from college students to practicing physicians. And the advice that I can give to almost every single one is the most important question you need to ask is why, right? And what I mean by that is that oftentimes students ask, how is that done? What is that procedure? Or, uh, but they never ask why, and I think understanding why is the most important part of any profession, but especially medicine, knowing why something happens, knowing why we're doing something, knowing why I'm explaining it like that. That gives you a foundation that you can then use to expand on your own knowledge. So the most important question is why. The second advice I would have is communication. I find that more and more communication skills are suffering, whether it's technology, whether it's smartphones, whether it's all of the above. I think the ability to communicate well with other human beings in a way that is compassionate, is personal, and is effective is something that everyone needs to work on. And it's something I continue to work on, 27 years later. And the third thing I would advise is learn to be observant. And this is not just means that looking. When you're looking, you're sometimes seeing, but you're not registering what's going on. So being observant means picking up on the details, seeing where you can help out, and being of a good part of the team requires that you be observant of what the nurses are saying, what the patient is saying, what the doctor is doing. I find that, students, we can look at the same painting, Connor, but then if you're an art history major and you're observant, you know what to look for, you can see the details of the brushstrokes. Me, if I was not observant, I would say that's just a picture of a farmer. So we can both look at the same things, but the observant person will learn so much more. So bottom line, ask why, be observant, and communication.
Yeah, I think it definitely is important to be able to like genuinely have a conversation with the patient. From other physicians that I've talked to and like med students, someone told me once that being a server at a restaurant was really helpful because
Hmm.
it's like being able to just make small talk or like make them feel welcome can be really
Yeah,
helpful.
yeah.
Um,
And let me add to the communication part is um, I'm I think the most important part of communication is listening. And listening to what the patient has to say and I think that's probably the 90% of a good communicator.
yeah, I think it makes a lot of sense and it's really helpful, like you said, that having like scribes so you can just focus on talking to the patient. I also want to just open the floor up to you. I know a lot of pre-med students are interested in dermatology. So I was wondering like what drew you to that and like what advice would you have for anyone that wanted to pursue that specialty?
Right. So yes, dermatology is the most competitive specialty in medicine. And I would say that, in to become for me, when I was interviewing medical students for residency, what was most important to me were not the board scores, were not how many papers they wrote, were not their USMLE scores, because everybody who applies to dermatology has great scores. Everybody publishes, everybody has great recommendation letters. What mattered to me, what was most important to me is, are you a good doctor? Are you someone that I would want to treat my mother? So for me, the requirements of a dermatologist are the exact requirements of being a great physician. So for me, it's much more important that you're a good doctor than to have all those check boxes. And I think as medical students too often are so laser focused on dermatology, and these days um, you have to start your competitiveness year one. You can't wait till year two or three or four to say, "Hey, I want to be a dermatologist." But because you're focusing so much early on, you're not devoting yourself to the rest of medicine, which I think is very important and arguably much more important. I think so much of dermatology involves internal medicine and knowing the other diseases that can affect the skin, that if you treat the other rotations as um, something just to go through rather than completely immerse yourself in the experience and the knowledge of being a great doctor, you're doing yourself and your future patients a great disservice, no matter what specialty you're in. So that would be my main advice, is to focus on being the best physician that you can, while at the same time finding a good mentor in dermatology that can guide you the process. Maybe find some projects that you can work on, do some publications, and do the check boxes. But that's not nearly as important as acquiring the knowledge and the skills to be a compassionate and wonderful physician.
Yeah, that makes a lot of sense. Well, I just wanted to say thank you so much for joining me. I know a lot of pre-meds and a lot of people that are listening are going to find this helpful and hopefully resonate with it a lot. So yeah, I just want to say thank you so much for joining my podcast. And it was great to listen to all your stories and hear all the advice that you had.
Well, thank you, Connor. Appreciate you having me
Yeah,
on.
of course.
Thank you again for tuning in. You can find all of our links and social handles in the description below. We hope to see you all at our next GBM on October 23rd.